I want to welcome you to this special recording on how to avoid uh, pregnancy after sex. Pregnancy um, that is unprepared for could be burdensome. It could be emotionally disturbing and become a source of social ridicule for the woman. Therefore, if you do not need pregnancy for now, it is better to be prepared on how to avoid it, especially after sex. Now, there are several ways to avoid unwanted pregnancy. Number one, you can decide to use a condom. This is a picture of a condom. It's a lady with a condom in her hand. Uh, Not only that, you can decide to use oral contraceptive, which is about 99% effective. Uh, these pills usually contains combination of two uh, hormonal drugs, estrogens and prostrogen, which will stop a woman from ovulating. Sometimes it can reduce bleeding during menstrual period, reduce menstrual pain, and also protect the woman against um, some form of ovarian problems. Now, this form of contraception, these oral contraceptive pills, it's suitable for almost everyone except people with that are predisposed to breast cancer and cervical cancer, uh, or maybe when you have some unwanted, you experience some unwanted feelings after taking oral contraceptive pill, you can change to another one and change to another one until you get the one that best suits your health. Um, Another way of avoiding unwanted pregnancy is by what is called contraceptive injection. To be specific, we are talking about Depo-Provera. Depo-Provera. Depo-Provera um, releases prostrogen very slowly into the body and stops a woman from ovulating. It can also help in thickening the cervical mucus so that it will not allow the sperm to swim very well before meeting the egg. The injection, Depo-Provera, can last for about 3 months, and then that means it will be given every 3 months. The only problem is that sometimes the woman may gain weight, and there could be irregular periods after a prolonged usage of Depo-Provera. But in any case, I will advise that it be used for women who are almost beyond childbearing. They don't want to bear child again and feel like protecting themselves. It is good to use Depo-Provera. Now let's continue. This is a typical bottle of Depo-Provera containing 400 milligram per ml, and each vial contains 2.5 ml. That means about 1 gram is involved in one vial of Depo-Provera. Now, another way of preventing pregnancy is through contraceptive implants. Um, Something like a rubber containing some contraceptive chemicals can be inserted underneath the skin without using local anesthesia, and then it will not bring out any wound. It will just be a little bit red and tender for some time, and then that's all. It's so good and it's almost about 99% effective. Most of the time they use the upper arm, and it releases progesterone hormone into the bloodstream, so that they can stop ovulation and also prevent the fertilization of the sperm, of the egg by the sperm. Now, a single tube that is inserted underneath the skin can work up to 3 to 5 years. However, as soon as the tube is removed, the woman's fertility may remain to normal. However, first year after the removal, there could be irregular period. Even first year during the usage, there could also be irregular period. And then sometimes the woman may gain weight and so on and so forth. There may also be some little side effects like headache, breast tenderness, mood changes, and so on and so forth. All things being equal, it is very effective. 99% effectiveness, it's a good thing. It's a good thing. Now, another way to prevent pregnancy is by female sterilization. Now, this can be done by uh, uh, tying the fallopian tube here, if you want it reversible. If it's not going to be reversible, they do a little bit of surgical cutting of this place. And then once this is cut, it means there is no way that any sperm cells that is swimming up here can go ahead and fertilize the egg. The egg cannot move, the sperm cannot reach the egg, and it simply means that there is no hope for pregnancy. Now, if it is to be reversed, then you may just tie it. If it's to be an irreversible female sterilization, then it may be cut. It's a permanent form of contraception. Then we have vasectomy, male sterilization. Now, during this procedure, the male vasa differential, that's this tube here, is cut into two. It's cut into two. It's severed. Now, once it's cut, it will prevent the sperm from entering into the ejaculate. That means the seminal stream. Therefore, there won't be sperm inside the ejaculate, and therefore fertilization becomes literally impossible. It's a very quick operation that is performed under local anesthesia. Then there are some possibility of having post-surgical complications such as bleeding and infection, but it can easily be controlled by good antibiotics. Now, this one will not affect the ability of the man to have erection or ejaculation. The only thing is that the sperm cells, which is a very small part of the seminal fluid, about 1% of the seminal fluid, will not be there. And then a man may not even notice any difference in ejaculation. The body will just absorb the sperm cells, and that's all. That's what's called male sterilization. Um, I will not advise that for any man that still want to produce. Once you sterilize yourself, that's a permanent contraception. Let's continue. Now we go to this natural family planning. This method is 98% effective. The people concerned will have to study the safe period during the menstrual cycle. The safe period usually is from day one, or let's call it day zero, the day you start menstruating, till the 8th day. Then from the 9th day to the 28th day is not really safe. Actually, 14th day of the menstrual cycle is the ovulation day. But to be quite uh, 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 protective of yourself, now you have to abstain from sex from the 10th day till the 28th day. Then from 20th day to 28th day, you may have sex, and you are safe 98% of the time. Then there is also, we can even call this one another way of natural family planning. It's called male withdrawal. That is when the male partner suddenly withdraw from the vagina of the woman before ejaculation. However, it's not 100% effective because the pre-ejaculation seminal fluid can contain some sperm cells, and that can cause an unwanted pregnancy. Now, then we also have the use of intrauterine device. It's called IUD. IUD actually is a T-shaped device that is inserted into the uterus by a specialist, an healthcare professional, a doctor. Now, it could remain in place for more than 5 years, between 5 and 10 years. It has one of the lowest failure rate. It doesn't really fail. Now, but sometimes IUD can be displaced, and therefore the woman will be in danger. And then sometimes there could be abnormal bleeding, abdominal pain that is called cramps. But this may occur either during the insertion or maybe immediately after the insertion. All things being equal, this is it. This is the intrauterine device. Sometimes it contains the rubber part could be a form of slow release of progesterone, and then sometimes it could be even be copper wire. Now, the real contraception comes from the chemical constituents of what is inserted. Um, then we now come to the use of emergency contraception. I'm sure you have been waiting for this. Now, this is in two forms. The first one is the use of postinol. Now, postinol is in two forms. There is postinol, ordinary postinol. There is postinol 2, which is also called Plan B or non-level. Now, postinol 2 contains 0.75 milligram of levonorgestrel, and it's a good it's a good contraceptive. It is to be taken within 72 hours of unprotected sex. If you have unprotected sex, you take postinol 2 uh, within 72 hours. Actually, the earlier you take postinol 2, the better. And postinol, ordinary postinol is still effective, but postinol 2 is more effective. The difference between postinol and postinol 2 is that postinol contains 1.5 milligram of levonorgestrel, while postinol 2 contains two tablets, each having 0.75 milligram of the active constituent. Now, when you're using postinol 2, the woman must take the first tablet as soon as the sex take place, and then the second tablet is taken 12 to 24 hours after the first tablet. Now, one funny thing about the constituents of postinol is that most birth control pills also have similar constituents. The only thing is that you may need to take up to 4 tablets of those control pills, those oral contraceptive pills that contains estrogen and progesterone. When you take up to 4 tablets, it's equivalent to postinol 2, and then you take the second dose of the same number of tablets 12 hours after the first dose. Then the second type of emergency contraception, it's what is called morning after intrauterine device, which must be inserted maybe within 5 days of unprotected intercourse, and then it can stay like that 5 to 10 years. Um, get to my channel, you get more of videos on YouTube on how to avoid pregnancy, especially on the use of postinol 2. Thank you.